So you talked about how humbling ultrasound is, um, and how people are sometimes quick to go another route. But the flip side of that is that I'm you would say that would you say that ultrasound is also on the other side of that an incredibly powerful tool in medicine today?
Yeah, and that's why people that are deep into their practice that maybe stopped considering new things about their practice long ago are considering this, right? It's why they're having these experiences that they don't like, because they, especially when they're surrounded, like in our department at Sinai Grace right now, we have a really young like physician group. We have a couple of older holdovers that are constantly remarking at like the things these young people are finding and doing with ultrasound that they won't even consider doing.
Huh.
Something as simple the other day, we had some guy, we have Fridays are like our dedicated teaching days at Wayne State for ultrasound. So we have a group of residents that we rotate around the various hospitals in the city. And so we were scouting the tracking board towards the end of the shift, and we saw this guy who was old and obese and he had groin pain. And so I said to the group, I'm like, let's go find this guy and tap his hip effusion. And they're like, what do you mean? And I said, well, generally if an obese person is complaining of groin pain, it's actually their hip. It's not like a hernia, it's not a kidney stone, it's usually their hip. And sure enough it was. And I'm not saying this to like brag, that I was, able to tease this out just from like the demographics of the patient. But what we ultimately
That's
did,
experience, right? I mean,
and that's something that you can have no ultrasound as part of your practice and still be able to make that assertion. But the next step was actually treating him. And so we found the guy, we brought him into a room, we scanned him, he had a hip effusion, and we asked him if we could drain it. And I asked him if I could have the residents drain it. They had never done it before, but I was going to walk them through it. So we did it. And then we just went back to the doctor that was seeing him. And when we told her, we're like, so we diagnosed the guy's hip effusion, we drained it. Here's the joint fluid if you want to send it to the lab. And we're done. Like it was the end of our day. It was like a mic drop moment. And she's like, what did you do? And I was like, well, we're looking for MSK pathology today. We dug this guy out of triage and here you go. And she was just stunned. She's like, it never would even have occurred to me that somebody could do that in the ER.
And you were able to confirm that with the ultrasound?
Mm-hmm.
Okay.
So we found the hip effusion, and hip effusions just specifically are notoriously difficult to identify. X-rays miss them all the time. And so you really got to have a high index of suspicion is sort of the medical buzzword we'll use for things that are hard to diagnose. And often they're found incidentally on CTs and MRIs. And so we drained the guy's hip effusion, and then she had already ordered a CT because the team thought he had a kidney stone. And so he had no kidney stone. And sure enough, on the CT is his hip effusion that was also missed by the radiologist because they weren't looking for it. They were looking for the kidney stone. And then so she texts me the next day and she's like, this was like magic. Here's his hip effusion on the CT that nobody found. And by the time I went to go see him again, you guys already drained the effusion and he was like magically better. So thank you. And so those moments happen. Like that was a pretty stark one in terms of just the way it happened, how it was carried out. But those stories will percolate, right? So they'll percolate amongst the physician group. And then these older docs will be like, man, I got to learn this. That, if for nothing else, like that's cool. Like that is like a really fun, cool way to practice medicine. And obviously in that case, certainly benefited the patient. So yes, like hugely powerful and beneficial. And like other physicians see that. And the phrase I use is everybody wants to know how to do ultrasound, but nobody wants to learn how to do ultrasound because it's really hard. It's just really, really hard.